Well, health officials across the country are closely monitoring a triple threat of respiratory illness. The CDC reports emergency room visits for flu and COVID are rising, and RSV, a common respiratory infection, is still spreading in many states, posing a danger to babies and older Americans. Dr. Tucker Woods joins us now to discuss this. He is the chair of the emergency department at Lenox Health in New York's Greenwich Village. Thank you so much for joining us. So we were just talking because I was saying it feels like COVID's making a comeback because there's several people I know who got it over the holiday break. Health officials have been warning us that a triple-demic was coming. Are we now in the midst of it?
Sure. It's sort of like deja vu all over again, but we are in the middle of it right now with the weather getting colder and people getting together during the Thanksgiving holidays, Christmas holidays, a New Year's party. They're in close quarters, indoors. They're sharing their air with each other.
Yeah.
And so we've just seen our numbers of COVID and flu cases explode in the last 2 weeks. And RSV is pretty moderate also. So it's sort of the triple threat you spoke of.
Right. So, but here's the thing about these three illnesses is often they can share symptoms. You know, usually if you have the flu, you generally maybe hang out on the couch. But if you have COVID, you're going to lock yourself in the room. You know, you're going to be a little different when it comes to interacting with people. So how can you tell if what you have is just maybe a common cold, sniffles, or one of these more serious illnesses?
It can be pretty tricky because a lot of the symptoms are very similar. With flu in particular, you're going to have a fever if you're an adult. So that's one of the ways we can tell the difference. But all of the symptoms, they really overlap. So even when we work in the emergency department at my site, Lenox Health Greenwich Village, sometimes it's the only way we can really tell is with a test. And so we test for these different viruses.
I'm not even keeping track of like the booster situation for COVID anymore. And I think a lot of people, maybe they got their fourth, and then I imagine the numbers have trailed off significantly. What is the current situation when it comes to boosters? You know, who's being asked to go get one? Should we all get one considering the circumstances?
Sure. So with all three of these, there's vaccines available. So with RSV, there's a vaccine available if you're 60 or older. Same thing with flu. I get my flu shot every year. And then there's also the new COVID booster. Our big recommendation is that if you're at risk for developing severe illness to get your shot. And so you're talking about adults 65 and older, or if you have underlying diseases like diabetes or you're immunosuppressed, they're the most vulnerable.
So, I mean, people gathered for Thanksgiving, right? And then I guess we're now seeing the results of that. Are we expecting like another boost in these viruses like later on, or do you think that this is where we're going to be at least for the season? It
hasn't peaked yet, but it'll eventually peak.
Okay.
But there's different things you can do to protect yourself. You know, if you're sick, just stay at home. You don't want to tough it out and infect your coworkers.
Right.
You want to practice good hand hygiene, wash your hands frequently, avoid touching surfaces and then touching your eyes, ears, or your mouth. That's a good way you're going to get it. And just listen to your body. If you're feeling sick, just stay home. And you want to have healthy personal habits like getting plenty of sleep, exercising. That helps your immune system. So you want to practice some of those common sense steps.
I think that's a really good reminder, doctor. I think, you know, a lot of people during COVID, you had a clear test, so you could say, sorry, I can't come in. But I think that sentiment has started to sort of dissipate a little, and people are back in the toughing it out phase. So it's a good reminder, just stay home, take care of yourself, and protect other people.
Definitely.
Dr. Tucker Woods, thank you so much.
My pleasure. Thank you.